10% chance of rain. Carol?
All right, thanks, Pete. How far are you willing to go to get back a full head of hair? Hair restoration is big business these days. In Healthy Living tonight, see how a new technique is giving more natural results.
You ready?
I'm ready.
Okay, let's see.
Jack Clark is growing a new head of hair.
Here, we discussed filling in some of your crown here.
What you see on top is new. He's undergoing a state-of-the-art hair restoration technique, and today is the third and final session.
I want a combable head of hair, and I want one that I can style, and I want one that's mine.
Jack started losing his hair in his mid-20s, and he tried everything.
I tried the shampoos, I tried the pills, you name it. I rubbed it on.
These pictures tell the story. Even with family and friends, Jack was self-conscious about his balding head. You rarely see him without a ball cap or a do-rag. And for a few years, he even wore a hairpiece.
It's too high maintenance. It didn't look real. It looked like there was a critter on your head. It would itch and just drive you nuts.
It's called male pattern baldness, and it's hereditary.
My great-grandfather was 100 years old, and he still had all his hair back here. He didn't have any up here, but he had all it back here.
What we're going to do here is we're going to go ahead and mark this area.
Dr. John Mendelsohn, a cosmetic surgeon, says Jack is a great candidate for microfollicular grafting.
But these are not plugs. These aren't like what they used to do in the old days where you used to see the little doll's hair and the cornrow.
Jack gets a local anesthesia.
We're going to go ahead and make a little incision here.
Then the doctor removes a strip of hair from the back of Jack's head. A team of assistants takes the skin graft and carefully isolates each hair, preparing it for transplantation.
Then what we're going to do is make very tiny incisions, probably 1,500 of them in the crown region, and anywhere we can fill them in this region here.
It can take a few hours or an entire day. But Dr. Mendelsohn says transplanting single hairs instead of plugs in a natural pattern gives better results.
Our goal here is to establish as great a density and as natural look as we can through the use of these microfollicular grafts, these little tiny hair follicles, individual hairs.
Things you should know. There are risks, as with any surgical procedure, but Dr. Mendelsohn says they're usually minor. To get a full head of hair, you might need several procedures like Jack. And fees range anywhere from $4,000 to $8,000 per session.
These will grow forever. He's never going to lose these.
We won't get to see Jack's new head of hair for about 6 months, until it grows out. But Jack's seen the before and after pictures of other patients like this one, and he's optimistic about his own future. He's already seen some growth, and he doesn't mind posing for pictures anymore.
And I'm not wearing a hat, so I'm just tickled to death.
And Jack says he had some numbness on the back of his head for a couple of months until the skin healed. Other than that, he had no side effects. And Clyde, this technique can help women too, because some women do have the same problem.
Right. I'd like to go back and see how that works out for him, for sure.
Yeah, we're going to go back and check.
But now, is everybody a good candidate for this, or are there some people who aren't?
No, unfortunately, if you're shiny, slick, bald all over, then it won't work for you because the doctors do need some hair to work with, like from the back of your head. But meanwhile, we are going to check back with Jack in several months to show his progress.
All right, I'd look forward to seeing that.
Yeah.